To qualify for weight loss surgery, you need to be at least 100 pounds over your ideal body weight. Your BMI also needs to be at least at 40. Some people can qualify for surgery if their BMI is at 35 to 39, if they also are suffering from severe health complications due to their weight. Before you can have a weight loss surgery, you also have to be evaluated psychologically to make sure that you are emotionally and mentally ready to prepare for the surgery, leading up to the surgery, and then life after the surgery. Before weight loss surgery, you want to prepare your body at least 2 weeks in advance with a modified diet. During this, you want to consume about 800 to 1200 calories a day, as well as 70 to 120 grams of protein. This is going to help decrease any complications after surgery, as well as prepare your body for a healthy new lifestyle. You want to increase your vitamin supplements. This is going to help your body recover quickly. You also want to decrease any fats, sugars, or carbs from your diet. Avoid any alcohol or smoking, and just make sure that your body is at its healthiest before the surgery. This new healthy relationship that you build with food before your surgery is going to help make an easier transition into your lifestyle after surgery.
Gastric bypass is a combination procedure using both restrictive and malabsorptive elements. With this surgery, first the stomach is stapled to make a smaller pouch. Additionally, part of the small intestine is bypassed, causing you to absorb less of the food that you eat. The result is that you cannot eat as much and you absorb fewer nutrients and calories.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. This smaller stomach pouch restricts the amount of food that can be eaten before feeling full. The small intestine is separated into 2 sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine, where digestion continues. Bypassing a portion of the small intestine decreases the absorption of calories and nutrients. The upper portion of the small intestine is reconnected to the lower portion of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested.
Study shows that after 10 to 14 years, gastric bypass patients have absorbed 59% of excess body weight loss. Some of the pros of getting gastric bypass surgery include that weight loss can be very swift and dramatic. About 50% of it happens in the first 6 months, but you can lose weight up to 2 years. Because of the rapid weight loss, conditions affected by obesity, such as diabetes, high blood pressure, high cholesterol, arthritis, sleep apnea, and heartburn often get better, and this happens very quickly. Some of the cons of getting gastric bypass surgery include that you won't absorb the food the way that you used to, and that puts you at risk for not getting enough nutrients. The loss of calcium and iron could lead to osteoporosis and anemia. You'll have to be very careful with your diet and continue to take supplements for the rest of your life. Another risk of gastric bypass surgery is dumping syndrome, in which food dumps from the stomach into the intestines too quickly before it is being properly digested. About 85% of people who get gastric bypass have some dumping. Symptoms include nausea, bloating, pain, sweating, weakness, and diarrhea. Dumping is often triggered by eating sugary or high-carb foods, and adjusting your diet helps tremendously. Unlike adjustable gastric banding, gastric bypass is generally considered irreversible.
Hi, I wanted to share Kendra's story. She got her gastric bypass surgery January 4th, 2005. She weighed 294 pounds at 5'8". A year after that, she got down to about 165 pounds. She loved the results of her surgery and would definitely do it again, but she had a very difficult time learning to adjust her eating habits. The plan after her surgery was to drink 2 ounces of liquids for the first 2 weeks, like water, broth, 100% juice, nothing carbonated or with sugar. The next 4 weeks, she'd be on a soft diet of scrambled eggs, crab meat, mashed potatoes. The next 4 weeks, she could add easy-to-chew meats like chicken and crawfish. By 3 months after surgery, she should be able to eat anything with less than 3 grams of sugar, still nothing carbonated. She, however, was unable to eat anything more than 2 ounces for up to 6 months. Learning how much she could take to eat, she often made herself sick. Still to this day, if she overeats, she will still get sick. Kendra's best way of explaining the surgery was that she has 2 stomachs. One's attached like ours, and the other one is just closed up. Something that amazed her the most about her surgery was that hormones are stored in our fat glands, so losing all that weight so quickly made her very moody. One of the necessities for the surgery is having such a great support system. She recently had an upper GI, and her doctor performing this surgery said they had never seen her gastric bypass surgery as clean as hers was. Kendra is now at a weight of 175, and she still doesn't drink soda. And you can see her before and after pictures. Next, Chris Cannon would like to share her story of her gastric bypass.
I had gastric bypass on January 18, 2010. I thought at the time it was the best decision because I was 4'10" and weighed 278 pounds. Diets wasn't working, and I had health issues that were getting worse. So I had the surgery. First, I was severely allergic to the drain they left in me. It had to come out as emergency surgery. Then my journey began. I had a problem with smell, and the protein made me very sick. I was to put this protein in everything, and I just couldn't do it. I could smell food, and I would get sick. I tried to drink Glucerna, and that's what I drank for a while, but I had to take nausea meds to keep a sit down. There was no way I could get the protein in that I needed. So I started dropping weight really fast. After many exploratory upper GIs, endoscopies, and colonoscopies trying to find the reason I couldn't eat or I was losing weight. I weighed 82 pounds and I couldn't stand up. I just laid in bed in pain and hungry. I refused feeding tube because I wanted to eat. I felt like if I got a feeding tube that I was going to die and that I would be left with this feeding tube. That would have been the end of me. So I fought it hard. I had the doctors go back in and try to fix my bypass to save my life. I knew it was a big chance I'd die, but I had to take that chance because I was dying anyway. So I prayed really hard and had the surgery. I was terrified because I just knew I'd never see my kids or my family ever again, and that I was going to leave them. Well, I made it out of surgery. This gave me faith that I could get better and there was still hope. The doctors put me on some steroids and told me to only eat ground up meat, no carbs at all, no sugar at all, a gastric bypass drink mix only. Well, as I was getting better, I started having seizures that the doctors say came from the malnutrition, from the surgeries. I'm still having seizures, but I weigh 115 pounds and I'm eating a little bit better and I'm getting stronger and I'm alive. The best thing, it might have been the best thing for somebody else, but it sure wasn't for me. Thank you.
My name is Jill Smith Austin from Gadsden, Alabama. I had struggled with my weight all of my life. I was always bigger than all of my friends. I was made fun of all through school. I got married at 23 and gained over 100 pounds the first year that I was married. I divorced and remarried, and at the age of 33, I had a son. There were so many things that I couldn't do with him because of my weight. In 2002, I threw a blood clot from my left calf that went through my heart and lung. The doctor said that most people wouldn't live to tell it, but I did. That caused me to start thinking about losing the weight and having the gastric bypass. I decided to have the gastric bypass in August 31st of 2004. I was 44 years old. I was the 7th girl at my job that decided to have it. They were all doing great. I weighed 418 pounds the day that I had it. By Christmas morning, I had lost 100 pounds, and I knew that I could make it after that. In all, I lost 232 pounds. But as the years went by, I started gaining it back. In 2004, I had a gallbladder attack and had to have surgery. The surgery nearly killed me. Mainly, I started drinking carbonated drinks, which was something I had been told I could never do again, and which I didn't for several years, but once I had one, I was hooked again. I gained over 100 pounds, and in 2009, I went into a heavy depression. I quit my job and started staying at home. In July of 2013, I had a wreck and actually died, but was brought back to life. In September of 2013, I started feeling really bad, and by October, I had been rushed to the hospital, screaming in pain. My husband called an ambulance. I had an ulcer that burst in the top of my gastric bypass pouch. They had to send me to another hospital for emergency surgery to save my life. During the surgery, the surgeon nicked my spleen and couldn't save it. He punctured my lung and it deflated. He was not a gastric bypass surgeon, and he had to completely redo my gastric bypass. He messed me up pretty bad. I ended up with so much infection from all of it, it almost killed me several times. I had 13 surgeries within a 10-month period. I even ended up on a TPN feeding tube, and I could not eat till a surgeon in Birmingham finally fixed that. I started my journey of losing the weight again. I have never been the same because of all the health issues, but if I had a choice, I would do it all over again. Yes, I had 9 great years before all my health issues. Gastric bypass doesn't fix your fat problems. Your weight is a lifetime battle. It doesn't change your mind about food and drinks. I am a food and drink addict. And really most people are, but they just don't realize it. Carbonated drinks is a cause for a lot of it, and most people don't know that. I am living proof of it. I am still having problems with both of them today. I have hanging skin, but not like a lot of people. I camouflage it a lot. Do I recommend gastric bypass? Yes, I do. But you need to do a lot of soul searching on it and research. The health rescues are great, but I believe that the good outweighs the bad. A lot of my friends ended up in divorce over it. Find a good gastric bypass doctor. Take your vitamins. Find a good support group to attend. They will help you on your journey more than you can imagine. The surgery does change you. My only regret is that I didn't have it at a younger age. I'm 55 years old. I wore a 5X clothes. I weighed 418 pounds. I've lost 278 pounds. I weigh 140 pounds today. I'm still on my journey, but I'm feeling good and doing good.
Day after day, I'm more confused. Yet I look for the light through the pouring rain.
Sleeve gastrectomy is a surgery to help patients with severe obesity lose weight. It is typically only performed on patients with a BMI of over 50. During the operation, a thin vertical sleeve is created in the stomach by using a stapling device. Now, a typical stomach can hold between 1 liter to 1.5 liters of food. After this surgery, the stomach can only hold about 50 milliliters to 150 milliliters. That cuts the size of the stomach by about 9/10. Now, to give you a better understanding of the surgery, I have a couple pictures here. This is before, just the size of the stomach, and this is the after. Now, this red line is where the stapling device takes that part out of the stomach. That part's removed, and that's the new stomach right there. Obviously, it looks like a sleeve, which is where it gets its name. Sleeve gastrectomy is gaining popularity rapidly in the United States, and it rivals the weight loss of that of gastric bypass. The cost of this operation typically ranges between $13,000 and $30,000, while the national average sits at $19,000. The surgery takes about 60 to 90 minutes, and the patient is usually in the hospital for 2 days after that, just to make sure that everything's functioning properly. Now, obviously with surgeries, there are clear risks. Risks with sleeve gastrectomy include gastritis, which is inflamed stomach lining, injury to the stomach, intestines, or other organs, as obviously they're cutting things open in your stomach. Now, scarring of the stomach after the surgery is also a normal risk that people have to be worried about. One other risk after the surgery is vomiting. Vomiting from eating too much, since this new stomach can only hold about 1/10 of the food that the old stomach used to hold. Patients who receive sleeve gastrectomy typically lose weight for 2 to 3 years.
The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy.
Gastric banding is a surgery in order to help people lose weight. It is meant to make the stomach smaller and make you feel full more often without eating as much. It is done by several small incisions in the stomach and placing a ring on the upper part of the stomach. Attached to the ring is a tube that is left right under the skin where the doctor can add or take away saline with a needle. Saline is used to tighten or loosen the band depending on the patient. After the surgery, the band isn't inflated until 4 to 6 weeks after you have healed. After surgery, the first 2 weeks your stomach can only handle small amounts of liquids. Some may even feel full after a few sips of water. As you heal and are able to slowly add solid foods back in your diet, the doctor will then be able to make saline adjustments. Weight loss is gradual but steady, and you can always adjust the band. Some lose weight up to 3 years. It is highly suggested to go to a nutritionist and plan out well-balanced meals. Studies show that weight loss does occur, but it is much slower than other surgeries. Gastric banding is least invasive because there is actually no cutting on the stomach. But troubles can occur, such as band slipping and obstruction, which is when the band can cause food to block the opening of the stomach.
In preparation for the band, a tunnel is created behind the stomach. The Realize band is introduced to the abdomen through a trocar. The Realize band is positioned around the upper portion of the stomach and then secured using the locking mechanism. A tube attached to the Realize band will be connected to the injection port. The port is used to adjust the band tightness after surgery. An incision is made on the upper abdomen to insert the Realize injection port beneath the skin. The tube is secured using the locking connector on the port. The injection port and tube are placed beneath the skin. The Realize band does not alter your digestive function. Food consumed passes through the digestive tract in a normal route. Your surgeon may tighten the Realize band by injecting saline into the injection port. As the saline is introduced to the Realize injection port, it travels through the tube to the band. The addition of saline to the band creates a smaller upper stomach pouch. This smaller stomach pouch restricts the amount of food you can eat before feeling full.
Most people after weight loss surgery end up losing between 66 and 80% of their excess body weight. This is going to happen within the first 2 years, so it is going to take time to lose that. You also have to work to maintain it afterwards so that you're not going back to your original weight. Within the first 2 years of the surgery, you're also required to go to support groups that are going to help you emotionally as well as physically maintain your weight and continue to lose and make sure that you're where you need to be.